You know, there's this common idea out there that therapy is, well, mainly for people dealing with diagnosed conditions, right? Like
Hmm.
depression or anxiety.
Right. That's the typical picture.
But what if we looked at it differently? What if therapy could actually give anyone a boost, help with overall well-being, even if you feel pretty okay right now?
That's exactly what we're diving into today. We're trying to look beyond therapy as just uh, fixing a problem.
Okay.
We'll be using some insights from articles about these broader benefits, and we're also going to look specifically at how Edward Jenny and Associates in Pennsylvania approaches this.
So the mission here is,
Basically, to understand how therapy can enrich life in different ways,
yeah.
personal growth, handling challenges better, getting more mental clarity, and importantly, this applies whether you have a specific diagnosis or not.
Okay, let's get into it then. One thing that jumped out at me is this idea that therapy isn't just about problems. It's also about finding and boosting the strengths you already have.
Precisely. And that's often overlooked. We might not even recognize our own skills, or maybe we see some traits negatively.
Mm-hmm.
Therapy provides that structured space to really identify these strengths and figure out how to use them deliberately.
Like maybe you're very direct. You might think, oh, I'm just blunt.
Right. But a therapist could help you see how that directness is actually a huge asset in, say, leadership
Hmm.
or clear communication.
Yeah, the Alma article had a great example. Someone realized their quick decision making, which they maybe saw as
It
impulsive.
was actually a real strength.
Yeah.
And the therapist can help reframe that, maybe even point you towards careers or situations where that quality shines.
That reframing piece is so, so important. It's changing your perspective, seeing your own qualities as tools or resources.
Mhm.
And when you understand and use them strategically, you can face challenges differently, maybe see opportunities you missed before.
Okay, so another big area, preparing for change. Life is full of it, right? New jobs, moving, relationships ending or starting. Absolutely.
Yeah.
And even the good changes can throw you off balance. They bring stress, uncertainty.
Yeah, that's
Therapy
very.
gives you that dedicated space to process all, not just the feelings, but the practical side too.
The Alma piece mentioned someone moving across the country. The therapist helped with the emotional weight, sure, but also planning, thinking about potential
It's
problems.
like having a guide, yeah, helping you anticipate things.
And I loved this analogy from one of the therapists they quoted, Amaranta Henriquez. She said, therapy is like fireproofing your house before a fire, preventative maintenance.
That's such a good way to put it. It really highlights that proactive side. You build coping skills, self-awareness
Uh-huh.
within that supportive relationship so you're just better equipped for whatever is next, building resilience before you desperately need it.
And speaking of that support, therapy just offers this unique, safe space to, process things, reflect.
Exactly. Life moves so fast, it's easy to just run on autopilot. Therapy is that time you set aside to slow down,
Mm.
to step back,
Mm.
to really check in. Are my actions lined up with my values?
Mhm.
Am I moving towards what matters? It's deliberate self-assessment.
It's that chance to connect with yourself, which honestly usually gets pushed aside.
Right.
In this kind of space, it can also be really helpful for dealing with past relationship issues, right? Things that might still be lingering.
Oh, definitely.
Yeah.
Past experiences shape how we relate now, how we
Yeah.
communicate. Therapy helps you see those patterns clearly,
Uh-huh.
address maybe some unresolved stuff, and get a fresh perspective on how you interact with, your partner, family, friends.
The Alma article mentioned therapy helping people become more assertive, express feelings better, even
Yeah.
improve how they give and get feedback. These are skills everyone needs, whether you're in a crisis or not.
Absolutely fundamental skills. They make
Mhm.
all connections healthier, more fulfilling. You hone those in therapy, and it ripples out into your whole life.
Okay, what about feeling stuck? Like you have goals maybe, but you're just not moving towards them. Or maybe you don't even know what you want.
Yeah, that's a big one. Therapy can be a real source of accountability there. And direction.
How so?
Well, it helps you clarify what you really want,
Uh,
first off. Then set goals that are actually achievable and meaningful for you.
right?
And explore what might be holding you back. Uncover those ambitions and make a real plan.
The Alma article had examples of people exploring hobbies, new careers,
Hmm.
really digging into what brings them joy.
Yeah, it's like having someone help you figure out what's missing and then how to bring it into your life.
And tackling those limiting beliefs we all seem to carry around.
Precisely. Often the biggest roadblocks are internal, right? The
Mm.
stories we tell ourselves.
Right.
Therapy is where you can identify those, challenge them, and build more confidence, see more possibilities.
Which kind of leads to this other really interesting point. Sometimes we think we're fine, but there might be stuff lurking underneath.
That's a really key insight. We get so used to our own patterns, how we think, feel, behave, that we don't realize the toll they might be taking.
Right.
Therapy provides that safe space to gently unpack those patterns
Like the example in the Alma article about people pleasing. Someone might do it for years.
without fully grasping how it's impacting their own well-being.
Yeah. Therapy helps you understand where that comes from and then explore healthier ways, like setting boundaries,
Yeah.
which, let's be honest, almost everyone could work on.
It's about that deeper self-understanding, developing more adaptive ways to navigate the world, even if you don't feel like you're in crisis.
Right.
And those insights, they can make a huge difference in your overall quality of life.
Okay, let's switch gears a bit. Stress. It feels unavoidable these days.
It really does. And therapy is a powerful tool for managing it, finding more mental clarity.
How does it help specifically with stress?
Well, individual psychotherapy helps you identify the actual roots of your stress, not just the surface feeling of being overwhelmed, but what's really driving it.
Ah, okay, so digging deeper than just symptoms.
Exactly. And then developing practical, actionable strategies for lasting solutions. It's not about quick fixes that don't stick.
So moving from feeling overwhelmed to something more balanced, more sustainable.
Precisely. Which ties right into developing healthy coping strategies. That's another huge benefit.
Makes sense.
Therapy is crucial for building effective ways to cope. It helps you pinpoint your specific triggers
Uh-huh.
and learn healthier responses instead of maybe turning to things like, substance use or just avoiding problems altogether.
Right. And that McKendree University article mentioned therapists providing tailored tools. It's not one size fits all.
Exactly. Tools specific to your situation, which helps you regulate your emotions.
And interestingly, that article suggested therapy itself can be seen as a healthy coping mechanism.
That's a fair point. It's a structured, supportive way to face difficulties, explore things, gain insights. It definitely builds your capacity to cope. It gives you strategies for understanding the past and improving your mental health going forward.
So the benefits for stress seem pretty wide-ranging. You mentioned emotional regulation like mindfulness.
Yes, and challenging those negative thought loops, maybe using cognitive behavioral therapy, CBT.
Right, the thought, feeling, behavior connection.
Exactly. Plus, practical things like breathing exercises, relaxation methods.
Lots of tools in the toolbox.
And as the McKendree article notes, building healthy coping skills is personal. It involves things like strengthening social connections, accepting change, setting realistic goals.
Building self-image, keeping perspective.
Right. Prioritizing self-care. Therapy supports all of that.
And therapists use techniques like CBT, mindfulness, relaxation, guided visualization.
A whole range. And when you learn and practice these within therapy, it really boosts your ability to handle stress and builds that psychological resilience.
Okay, let's shift now to Edward Jenny and Associates in Pennsylvania. Their website says, we do therapy differently. What's that about?
Well, based on what they say, they really focus on psychotherapy combined with something they call collaborative assessment. That's their main way to help clients make real-life changes.
Okay.
They offer individual and couples therapy, both in-person, in PA, and online across the state.
And they talk about a collaborative approach, the whole team working with the client. How's that different?
It sounds like maybe a more integrated approach.
Mm-hmm.
Perhaps different professionals in their practice contributing to someone's care. They also stress the convenience, qualified experts available in person or online.
They also mention people feeling stuck in therapy, even after years. I bet that resonates with some listeners.
Oh, for sure. It's a common frustration. They position their collaborative assessment as the way to tackle that feeling, to make therapy more effective.
So it's still therapy, but different.
That's what they emphasize. Still therapy, but with this distinct assessment piece woven in.
So what is collaborative assessment, according to them?
Okay, so from their site, it sounds like it's not the traditional model where a psychologist gives tests and then writes a report for you.
Right.
Instead, the client is involved right from the start.
Right.
Therapist and client figure out the client's key questions together. Then they work as equals to explore those questions and find answers.
Interesting.
They also mentioned using specific psychological tests within this collaboration, saying these tests are powerful tools for bringing about change more quickly and making it last.
Definitely sounds like a more active role for the client. What about the practical stuff? Insurance,
Yeah.
fees.
Okay. They state they accept traditional Medicare. They say this gives them more flexibility in how they provide care and use their assessment methods.
Gotcha.
But for most other insurance, they're out of network. They do partner with a service called Mentaya, though, which apparently helps clients try to get some money back.
Okay.
Their standard session fee is listed at $200. And there are additional fees if you do the full collaborative assessment.
Yeah.
But they provide a super bill. That's the document you can send to your insurance to try for out-of-network reimbursement.
And if someone's interested, wants to learn more?
They offer a free consultation for new folks. You can ask for that through their website, www.inkblotdoc.com, or call them or book it online.
Okay.
And they encourage people to just reach out with any questions about therapy, the assessments, their services in general.
So, wrapping this up, it seems pretty clear that therapy offers way more than just treating diagnosed conditions. It's a resource for, well, almost anyone looking for personal growth, better stress management, more resilience, just better well-being overall.
Exactly. Whether you want to, tap into your strengths, get through big life changes, improve relationships, reach goals, or just understand yourself on a deeper level, therapy can really offer valuable support.
It's definitely worth thinking about how some of these benefits might apply to your own life, your own goals, even if things feel okay right now. And Edward Jenny and Associates inkblotdoc.com is one option in Pennsylvania with their specific collaborative approach.
Which leads to maybe a final thought for you, the listener, to ponder. What part of your life, even one that feels pretty fine right now, could possibly be enhanced? Could you get more out of it through some deeper self-exploration, maybe developing some new skills or perspectives, something to think about?